Well, it's a lot of work, but she's just worth it. It's like a child almost. You wouldn't deny a child anything. And she's such a good friend, and she's such a good companion. I don't know what it would be like to come home to an empty house. It's nice to have the animal to come home to.
Birds offer a different kind of companionship because they speak to me. So Luann, I love you.
These ferrets really make me feel better when I feel stressed out.
There was a cat in the crib when my mother and father brought me home from the hospital. My children had our Blue Point Siamese cat in the crib. They've been a part of my life, all of my life. They've enhanced my life, and I've enhanced their lives.
He's just kind of came into my life, and that's the way it is. I think animals find you, you don't find them.
That's the thing about puppies. I mean, there's not like people. They're not gonna rip you off, steal your boyfriend or girlfriend.
My fish just bring me to another place. It's like a whole other world in that aquarium. The colors and the movement. Just imagining what they must feel relaxes me.
I've always loved horses from a little girl. They're incredibly energetic and forgiving animals. They keep me grounded and in touch with nature.
If you have a pet, you're a lucky person. And if you give all the joy and love that you can to your pet, you're a special person. There's a way that pets help keep us humble and humane, and it touches both the masculine and the feminine within our nature. I don't know if you have a parakeet or a cockatoo or a cockatiel or a dog or a cat or fish or horse, whatever you have. It can be healthier, it can live longer. I'm Gary Knoll. I'd like to welcome you to a very special presentation on natural pet health. It'll be a fun journey. And the payoff at the end is that you might have a dog with you twice as long, or a cat, as you otherwise would have, without having to pay enormous vet bills. And even the question and controversy around vaccines. Should you automatically vaccine for whatever the vet says? Maybe not. We'll explore that as well. Join me now.
Have you been told that your animal has to be put to sleep because there's no hope, there's nothing more that science, that medicine can do for them? What I want you to know is that there is hope. 80% of the animals that come to me, I can help to lead a healthy and normal life. And if I can do it, other vets can do it also.
If you understand your dog or your cat's personality and integrate its personality into the diet that you feed your pet, the care that you take of it, even the inoculations that you give it, that can have an effect on the quality of its life and its relationship with you.
It's the spiritual connection that we have, why they're in our existence, why we love them so much. It is so real. And when we deal with animals in our practice, we always deal with them on 3 different levels: mind, body, and spirit. And if you just deal at the physical level, you will lose. You will have to lose. Here is a survey by the Morris Animal Foundation in 1998, and it shows that the top of the list of diseases that cats and dogs are getting is cancer. My first 15 years as a veterinarian, it was always skin conditions, gastrointestinal conditions, bladder conditions. Cancer was always way at the bottom. It was more or less a disease of old animals, and as you can see right now, cause of conditions in dogs, top of the list, cancer. Cause of disease-related deaths in dogs, cancer, 47%. That means almost 1 out of every 2. And also, you can see it in cats. Just as an example, this is a dog that his abdomen is full of lymph cancer, his chest is full of lymph cancer, and you could actually see the cancer process has actually eaten itself out of both cavities. This dog in this picture is 10.5 months old. And as you can see here, private Keaton, 13 months, 2 weeks old at death. So there's something wrong in our society if cancer is becoming the #1 disease that we're treating right now as veterinarians.
Let's say that you have a cat, and your cat is susceptible to kidney disease, diabetes, ticks and fleas, feline leukemia, emotional problems, urinary tract infections. How do you deal with these? What are the causes? Can they be prevented? Let's talk with Dr. Michael Dim. Michael, nice to have you with us.
Good to be here, Gary.
Michael, what causes all these conditions in cats?
The three main reasons why we see these problems in cats are, number one, the poor quality commercial foods that most of these animals are getting, mainly the dry kibble. That has to be the number one culprit of many of these illnesses. Second biggest factor is over-vaccinating these animals over generations. Vaccines have been around about 30, 40 years, so we're seeing these diseases related to over-vaccinating them generation after generation, a worsening of these problems that you just mentioned. And the third factor would be just inbreeding, too much overbreeding of some of the purebred animals.
Let's focus on vaccines. Which vaccines do you believe are overused or possibly shouldn't be used at all?
The only vaccine that is really medically necessary in the cat would be what's called feline panleukopenia, or feline parvovirus as it's known. That is the only vaccine that has been shown to actually maybe work in these cats and to stimulate lifelong immunity. And a series of 1 or 2 vaccines at 3 to 4 months of age probably is enough immunity for the lifetime of that animal. The unfortunate thing is that they're combined with other respiratory viruses that actually not only don't work, but sometimes actually lead to chronic respiratory disease themselves by injecting these modified live viral diseases into the animal. And so panleukopenia and rabies, as required by law, are the only 2 vaccines.
Which are the vaccines that you then would suggest people challenge?
The feline leukemia virus vaccine has not been not only tested for safety and efficacy, but it's actually been shown that cats over 1 year of age are able to actually resist the feline leukemia virus all on their own. So in essence, I would not vaccinate any cat over the age of 1 for feline leukemia virus. The other vaccines that are out there are, for example, there's one called feline infectious peritonitis virus, or FIP virus. Cornell University did some studies that actually showed that the cats that were vaccinated for that virus were actually more prone to the actual field virus, so you want to avoid that one. There's a new one coming out for Giardia, the intestinal parasite. You want to avoid that one. The problems with most of these vaccines in cats is that they're not tested over chronic periods of time. And that's the main problem, the repetition of these things, the combination of these things, bombarding the immune system year after year after year. And that's what leads to this immune destruction of all of these organs and all these chronic immune diseases we see in our pets.
Right over here, I have just a list of the potential side effects of just one of the vaccines given. It's called the parvo vaccine. And the list is immune reactions following canine parvo vaccines. This was compiled by Gene Dodds. Fever, stiffness, sore joints, abdominal tenderness, collapse, clumping of red blood cells, jaundice, general hemorrhages, liver and kidney failure, bone marrow suppression, where the immune system comes from, seizures, bloat, stained teeth, hyperthyroidism, hypothyroidism, and then in another list, in another study of dogs and cats after vaccines, immune suppression, autoimmune disease, rheumatoid arthritis, hip dysplasia, food allergies, itchy skins, chronic kidney failure, liver disease.
The flea and tick collars have pesticides in them.
That's right.
Sometimes the cat owner never takes it off.
That's right.
That means the cat is being exposed 24 hours a day, every day of the week, to a pesticide.
Right. And what it does is it confuses the immune system, and the immune system sees these things as foreign. And so you get an overstimulation of the immune system, and then you get a destruction of organs like the pancreas, like the kidneys. And
that leads to the disease and the kidney failure.
That's right.
What are we doing wrong? Why do we have an epidemic of cancer, hip dysplasia, arthritis, diabetes, upper respiratory tract infections, viruses in our dogs? To answer these